When a North Shore-LIJ ambulance answers a 911 call, chances are one of the responding emergency medical technicians will be a first-year med student from the Hofstra North Shore-LIJ School of Medicine. But picking out which EMT is the med student won't be so easy.
Although they're medical students with enormous amount to learn to be physicians, they are fully trained EMTs.
Guess who the student is? It's the one tending to this patient's injured ankle.
It's a really good bridge between seeing what things are like in the real world and learning about them in the classroom.
While studying to become a doctor, each medical student will see thousands of patients.
I got to go to the apartment of a woman who had just delivered a child. The baby had already been delivered. It was about 10 minutes old once we got there. But I got to take the vitals of the mother and also of the infant and help transport the woman and child to the labor and delivery in Forest Hills.
Typically in the first 2 years, medical students at other schools see just a token number of patients or no patients at all. And our students will have somewhere over 1,000 hours of patient contact during that same time.
Everything from bumps and bruises to life and death situations. Dana Bregman recently responded to a call where a patient was having congestive heart failure.
He had shortness of breath, he had diminished breath sounds. Once we got in there, the paramedic whom I was with put in an IV. We put on the heart monitor, and I was able to actually look at the EKG. At that point, you basically just need a transport. We gave him some aspirin. He didn't have chest pain, so we didn't give him any nitroglycerin, and just monitored to make sure that he wasn't diminishing further.
We certainly don't think that anyone learns by show and tell. You know, standing on the sidelines and watching someone else do things is not the way adults learn, and certainly not the way you want to train physicians. You need a real role, a real skill set, and you need to be in the middle of the action.
And in the middle of the action is where you'll find the inaugural class of the Hofstra North Shore-LIJ School of Medicine.
Learning how to be respectful to patients, understanding their circumstances in their life, developing communication skills that work, having people correct you when you do things wrong at a stage when you're comfortable taking correction, is all part of our developmental program to really develop the professional called a physician.
Things are very different reading it in a library at 1 in the morning as opposed to being on an ambulance at 1 in the morning and seeing things we're reading about come alive.
Rob Hoyle, North Shore-LIJ TV.